so good to
Hi.
see everybody. Idrani, it seems like just yesterday and also like a lifetime ago that
So
Eric and
right.
I were with you in India and Bangladesh, hugging our way through clinics, loving on all the babies. And that was actually the last trip that we took before COVID. I guess we
Yeah.
saved the best for last, but I'm really glad we got it in before the pandemic started. And we all have heard the reports. We know what's going on in India, and it's so sad and it's so devastating. Um, but that's why we're here today, is to give really, instead of just a news report, actually real reports from the field, what's going on in the cities and the villages, and what we can do to help moms and babies there. And before we get started, I just wanted to do a little introductions with everybody. I'm Heidi Murkoff, and I'm author of What to Expect When You're Expecting. I have a website, an app, and a whole bunch of stuff, including the What to Expect project, which is dedicated to helping moms around the world, just like you guys are. Um, I have gone around the world many times, and every time I realize that motherhood is the ultimate sisterhood. That no matter where I go in the world, no matter where a woman lives, no matter what her racial ethnicity, her socioeconomic profile, her religion, her politics, her beliefs, who she loves, every mom wants the best for her baby. We all share an incredible bond. And of course, every mom deserves the care that she needs during pregnancy, postpartum, before she becomes pregnant, the care that she needs that's respectful and responsive, that enables her to deliver a healthy beginning and a healthy future for herself and also the baby she loves. And that's what you guys at Jhpiego do for moms all over the world. And I was lucky enough to see that firsthand. So Idrani, do you want to tell us a little bit about you, besides that you're a mom?
Sure, Heidi. And I completely reciprocate the fact that we had such a wonderful time, just before COVID hit the whole world so badly, that you were able to come and see some of our work in India and Bangladesh. For me, I'm Indrani Kashyap. I am the communication specialist for Jhpiego. I've been here for 10 years, working to better improve the lives of mothers, families, babies around the world. And I'm so privileged to be able to do that and do this work. And it's never seemed more important than now, ever since COVID has struck, because I think it's a dual whammy for mothers and children. It's not only about the infection with the disease or the fear of the infection of the disease, but it's also limited health systems which are completely focused on trying to fight this pandemic. And so we are kind of losing out on, or at least there's a fear of losing out on, years and years of gains that we've been able to make for better quality, respectful care for moms and babies. So I think that's what we're seeing all around. But as an introduction, yes, I'm looking forward to sharing a little bit about what I'm sensing around in India, and also as a mom to two children, an 18-year-old and a 16-year-old, who are teenagers but have been home for the last 1.5 years almost, So yeah, so you can imagine. So yeah, I'm looking forward to our chat today.
Yes, well, you might need therapy too. We'll take care of that later. Bajali, how about you?
Okay. Yeah, Heidi, this again, I wanted to thank you, Jhpiego, and thank to you for giving us this opportunity to talk to you directly. And it's my privilege to be a part of today's conversation because I know how our system has been responsive to the continuum of care for mothers, for babies, for children. It was important to address those in such conversation. So without delaying, about me, I am Bijoli Sinha. I'm working as a state program officer and I worked in various maternal health program. And I'm truly passionate for maternal health because I believe if we work for quality care during maternal health services, we can reduce the number of avoidable maternal deaths, which still we are losing a few mothers. And also we can save many newborns with this kind of services.
Yes.
And I'm fortunate I'm with Jhpiego because it has given me an opportunity being a nurse midwife to flourish and to support the system with our skills and also to help other people to come up during this tough situation. And I'm really excited to share a few of the states' strategy which they have adopted, how to overcome with lockdown strategies, and also to provide continuum care. So I'm excited to do that. And also I would like to inform I'm also a proud mother. My
Yeah.
kids are, I have a daughter who is about to 9 years and a son who is 7. They are in the exploratory age group because they want themselves to explore. But with this current situation, we are not able to do that. But yes, we have some strategies. Obviously, I would love to share with other mothers so that we can come up and we can support each other sharing those ideas. So thank you
Definitely.
once again. Yeah.
Thank you. And Lisa?
Thank you, Heidi, and thanks, Bijali and Indrani. I'm so happy to join you. I'm currently serving as the Director for Maternal Newborn Health for Jhpiego headquarters. I'm a nurse midwife, like my sister Bijali, and also an infectious disease epidemiologist. And listening to you guys, it's just striking how mothers around the world, I think, are facing a lot of the same challenges. You know, we want the best for our children's education, and our health is important in and of itself, but often the health of our whole family ends up being resting on our shoulders, right? All the responsibility for the education, for the healthcare. And it's really, I think, notable to see how much mothers have found connections with each other in these really challenging times.
So
That's
true.
true.
And motherhood, the ultimate sisterhood. We all have to help a sister out.
Very true.
Yeah. So can you tell me a little bit, all of you, how the pandemic is affecting you personally and your work? I've heard that many healthcare workers in the field have gotten sick. I hope that none of you have. But that certainly makes it harder to provide the care that you desperately want to provide for moms who need it. Bajali, would you like to take that?
Yeah. Yes, obviously, the pandemic was so evident that it has impacted our entire economical system, our health system, our psychological issues. So yes, I do recognize that. So in this, I would like to say, like, I remember the anxiety when it started. The first case in India was detected in the month of February 2020, and I had stayed the same hotel. And due to the limited knowledge, how we had responded at that situation, I still remember. And that's how we means because of lack of knowledge, and it was revolving continuously. Similarly, like me, the system, whoever is working, whether it is a nurse, doctor, or the healthcare provider, they do had some information, and there were few information which were not been disseminated. So so that's how we had started. And with an anxiety, but obviously we had came out with some strategies which has helped the entire system to come out with to reduce those impacts, to reduce the maternal death or neonatal death, or means taking their services from the healthcare facilities. So so that absolutely I remember like how it has impacted.
Lisa, have you experienced that as well with healthcare workers in the field being afraid or getting sick?
Yeah, I think our healthcare workers are facing just unbelievable challenges right now, especially in the rural areas where, the pandemic has hit hard, but the health systems are struggling. They aren't quite as strong, the resources are less. And we know historically that that's where women and families face the most challenges. And so when healthcare workers get sick in rural areas, it hits especially hard because the resources to help them are less too.
Exactly. And Idrani, how about you?
Yeah, well, personally, Heidi, it's been a year like none other. And last year almost seems like cakewalk. I don't think there's a single household in the country that is not affected by the pandemic. All of us in our families know people, whole families that have been down with this virus. People are, we are every other day when the phone rings, we are scared because we feel there's another bad news coming our way. We know each of us have personally lost loved ones, and people are still fighting the pandemic. So it's been a very challenging time, and I can only, I cannot tell you the bravery and the grit that our health workers have shown in this time. And they've really been the superstars or the heroes or whatever you like to call it. It's if it wasn't for them, I don't think any of us would be able to kind of have the life that we're leading right now. So
Lisa, have you seen more hospitalizations of pregnant women with COVID? How has the system been coping with that? The interesting thing about COVID is that many of the symptoms sort of mimic in some ways pregnancy symptoms or postpartum symptoms.
You're so right.
You have that little cough at night, or you have shortness of breath, you're tired. So sometimes it's hard to tell until symptoms are quite severe. So what have you heard?
So yeah, you're totally right, Heidi. It's I feel like we're learning more every day. We're learning more about COVID and pregnancy, COVID during breastfeeding, COVID in newborns. And I think it is really striking, just what you mentioned. The women who have underlying conditions do seem to be at the highest risk of complications. And if pregnant women do get COVID, they're at higher risk of having to need ventilation support. They're at higher risk of ICU admission, higher risk of complications in general. And so it's really super important that we are not only maintaining health services in general for COVID, during COVID, but maintaining health services that can welcome pregnant women and take care of their special needs, just like Bijali was mentioning just now. And I think a new and emerging area is the whole area around safety of vaccines for pregnant and breastfeeding as well.
Yeah, yes, exactly. And I'm really heartened to see more moms in the US becoming vaccinated. But yeah, it would be super helpful if there were trials so that we could make all moms feel more comfortable about getting the vaccine, which is so important, because if you're doing any kind of risk benefit calculation, the risks of COVID are quite severe, and we don't know as yet. We don't have any proven risks of the vaccine. It's interesting that you work in both maternal health and epidemiology, and that you I don't know if you worked on the Ebola response, but we visited West Africa right after Ebola. And we visited other areas of the world where maternal health is sidelined. during whether it's a pandemic or an epidemic, or it's an area of conflict or famine, or natural disaster of another kind, maternal health is always the first to be put on the back burner, which is understandable in some ways. You know, pregnancy isn't a disease. It's it's part of life. However, it can definitely cast a long shadow on moms and babies. If you neglect maternal health care in the short term, you're going to have long-term consequences. So yeah, I don't know if any of you want to, Lisa, do you want to share something about that parallel?
Well, yeah, I mean, I think it's a really important point, and it makes me think not just about Ebola, but Zika as well. And we were fortunate to be able to work on the Ebola response, the Zika response, the COVID response. And I think, Zika is something that India had to face as well. And there are these themes that run throughout all of these: the importance of maintaining essential health services for women and families, the importance of strong integration between maternal health and primary care and infectious disease, all these things that we know need to happen for strong health systems to really function and care for the needs of women and families. But I would ask our India team, they're the real experts on the ground here. What do you all think?
Indrani?
So, I completely agree with what you're saying, Heidi, and we've seen that even happening in India. There have been, we also work in the private sector, and we have seen that in the, in the tier 2, tier 3 cities or the villages, there have been, first of all, many facilities get transformed into COVID facilities. So, the number of facilities that provide care become more limited. Healthcare workers get diverted into COVID management. So it definitely does impact. But I think one of the things that has helped, and as Bijali pointed out, is the ASHA workers, which are the accredited social health activists. They are the community health workers, the health volunteers. They've really done, and they really need to be celebrated as much as any other cadre of health workers in this time, because they have taken antenatal care home to the people. They have given the iron and folic acid at home to the women. They have, pregnancies that are at risk. They have connected those women with the health centers where they can get care, and we know so many stories of that kind, and so I think that is what has kind of really come to the fore, and how they need to be more empowered. And I think technology is another thing which is helping out a lot. Even in the tier 2 and tier 3 cities, we have this whole health and wellness center concept, which is really bringing primary health care closer to the community, so that people are going to be able to get care closer. And we are doing a lot of teleconsultations over there, so that women, even if they're not able to travel far, there are travel restrictions. Today, many parts of India are again going into lockdown. But just to facilitate, we've seen that bringing care closer to homes is such a game changer, and to enable them with technology is another thing that is really helping save lives every day.
One of the most inspiring things that we saw in India were the group prenatal classes in Rajasthan, where all the moms come together and they sit on the floor and they take each other's blood pressure, and they are checking each other for anemia, and they're asking questions, and there's a sense of camaraderie that. And one of the moms said, what I love best about this program is that I learn about my body, which I felt was so incredible, so powerful to hear, because that's what every woman should have, right? She should know what's going on in her body and be empowered in her healthcare. Is that something that has stopped happening during the pandemic, or are there still these group prenatal classes?
So initially, when lockdown started, means basically it was when it was the prenatal group antenatal clinics was been interrupted for a few time for some time, and then with precautions they had started after lockdown was they removed the lockdown strategies like from June, and also they came up with a strategy that the people whoever will be coming, they can come with a prior appointment in the rural sector. If you will say, okay, is it possible? Yes, they made it possible. They made it.
Yeah, and the only other thing I would like to say, Heidi, is that this actually went beyond being just about antenatal care, but also about trying to educate these families about, COVID. We were kind of the information about COVID was evolving, and in those initial days, very little was known, and so I think this program really helped because we were also able to communicate what is COVID, how do you protect yourself, what's the benefit of social distancing, why do you need to wash hands, what is the best way to wash hands, why is it important for you to wear masks. In fact, I know many of the community health officers or these nurses who are stationed in these communities, they made masks themselves, because in those initial days there was very little in the name of personal protection equipment, so they made masks themselves. They just got in touch, collaborated with a neighbor, with a tailor, and made masks and distributed masks amongst people. So I think this whole community feeling really went beyond just antenatal care and helped in many other ways as well.
That's so important, because the only thing that spreads faster than a virus is misinformation. And if you're sharing good information in the context of a community where everybody trusts one another, but the information is good and it's vetted, then you're really onto something. What about delivery? Lisa, has there been any sign that deliveries in hospitals have decreased, that moms were concerned about going to the hospital and instead decided to stay at home?
It's varied a lot, Heidi. We have seen some areas where there's been a decrease in facility deliveries, and it sort of paralleled this very concerning decrease we also saw in childhood and newborn vaccination as well. And that's going to be a big area for everyone to need to collaborate and recover on. I think there are some pockets where, the doors stayed open. And I think our India team has done so much work in this area, helping facilities keep their doors open to pregnant women so that when it is time for delivery, the doors are open and women can receive high quality care. The babies aren't waiting for the end of it.
So clearly we have our work cut out for us. All of you have your work cut out for you. But I think everyone has their work cut out for them in improving maternal health, recognizing the challenges that moms around the world face. Even though we are a sisterhood, in certain parts of the world, we face particular challenges and struggles, and we are our sisters' keepers. So we have to take care of our mom sisters. So Indrani, how can we help moms around the world through Jhpiego?
Thank you so much for asking that, Heidi. And you have such a following of millions of moms and people who are really invested in the health of moms and babies. And we are running a fundraising here in India to be able to help moms and babies and help with this, this COVID surge, which our country is facing right now. And, in this video, you will see a link to a donations button where, we want to be in ground zero. We know that this pandemic is kind of going into the hinterlands, going into the smaller towns, villages, and there is acute need of strengthened health systems and of care today. And we want to do that. And so, I would urge you and your followers to kind of contribute to that so that we can be really doing what really needs to be done for the health of communities, and we know that communities will thrive when moms and babies thrive. and
Yes.
families thrive because of that. So that's what we aim to do. And so with your help, we'll be able to do that.
Well, that's awesome. And we know that the contributions will be well spent because there's no better investment in our economic future and our future health than maternal health care and the health of our moms and babies. So thank you so much, guys. Thank you for spending time with me today. I could talk to you all day, but we'll have to do part 2 and continue this conversation. But I'm sending you big, giant hugs in the meantime.
Thank you so much, Heidi.
And
Thank
love
you.
all the moms and babies in India and dads too.